This pillow will save you the next time you find a breast lump and start to panic. Picture this. You've had a long day. You crash into bed, but there's something wrong with the pillow. There seems to be something hard inside of it. What would you do now? Tearing the pillow will ruin it, but you still have to remove it. This is the same challenge a breast specialist faces when we find a lump in your breast. We have to deal with it without causing any harm to you. Hi, I'm Dr. Gayathri. I'm a breast specialist, and this is the simple story I tell every woman who walks in scared after feeling a lump in her breast. When you feel something in your breast like a lump, the first step is actually very simple. Let's confirm it together. Just like when something inside a pillow feels off, you press around it to make sure it wasn't just the way you were lying down. I do the same thing in my clinic, gently, calmly, and systematically. I'm checking, is the lump truly there? Where exactly is it? Does it move a little? Does it feel soft or firm? Is it different from the rest of the breast? And sometimes what feels scary at home feels completely different during the examination. Hormones, timing in your cycle, even your sleeping position can make normal breast tissues feel lumpy. So, step one is just us being on the same page, nothing more. Okay, now that we know the lump is real, the next step is to understand what it looks like on the inside. And for that, we use ultrasound. Think back to the pillow. If you felt a lump inside it, you wouldn't rip it open. You try to peek inside first, press around it, hold it up the light, map its shape. Ultrasound does exactly that. When I'm scanning, I'm looking for simple things. Where is the lump sitting? Is it smooth, round, oval, or something else? Does it seem to be soft or firm or fluid filled? Does it look like something your breast commonly makes? Or does it look like something we should understand a little better? And this part, it's painless. No needles, no radiation, just sound waves. The same kind used in pregnancy scans. And most of the time, the lump turns out to be harmless. Sometimes the ultrasound shows a lump that looks calm, but it's not fully clear. It's like looking through the pillow fabric and thinking, I can see the shape, but I'm not sure what it's actually made of. So the next step is simply taking the tiniest peek from the inside. Not removing the whole lump, just a tiny pinch, like taking a crumb off of the edge of a muffin. We numb the area first so you barely feel anything. Then I use a small straw like tool to gently collect the tiny pinch. No cutting, no stitches, you walk out the same day. We do this because a lump can look one way from the inside and the other from the outside, but we still need to know its personality. Is it a soft, harmless lump your breast normally forms? A small fluid pocket? A firm lump from hormones? Or is it something your body prefers we remove? This tiny peak gives us the full story. And most women feel calmer afterwards because guessing ends and clarity begins. Now we understand the lump completely, and your body is better off without it. You have two ways to remove it. One way, the older way, is to make a small opening, take the lump out, and stitch it back. Just like opening the pillow, removing what's inside, and sewing it back again. This method works, it's safe, but it does involve a cut, stitches, and a longer period of healing. It's good, but it's not the gentlest option. The second option is the modern one, the gentle vacuum method. Instead of making a big opening, we use a tiny tube that slips through a dot sized entry and the lump is gently pulled out from inside. No stitches, no downtime, a tiny opening that closes on its own. For the right kind of lump, this method is a complete game changer. It maintains the breast shape beautifully and feels far less invasive. This is the method I use most often because it's kinder to the breast and kinder to you. So, by the end of this step, there is no panic. We know exactly what the lump is, we know whether it needs to stay or needs to go. And if it needs to go, we choose the gentlest, safest way to do that. That's the pillow story, simple, clear, and fear free. Follow me for more such stories to help you understand your body better.